typically this time of year, I get patients that come in with sinus headaches, and that can be from a multitude of reasons. The changes in seasons, the weather, different things blooming, and ultimately these sinus headaches result in a ton of pressure centered around the sinuses. And so I'm going to give you a few techniques you can use to help alleviate some of these symptoms. So what you'll find, people with sinus headaches, is they'll be tender in the sinuses in those areas. So what I'm going to have my subject do is apply pressure to his maxillary sinus, and you can sometimes gently rub in circles there, and they'll be tender from time to time. And you do this for anywhere from 30 seconds to a minute. The other area I'll have you apply pressure to is the frontal sinus, right in the corners of the eyes there, just below the eyebrow. And applying pressure there or rubbing in small circles for 30 seconds to a minute until the pressure is alleviated helps. Ultimately, when the sinuses are congested, or some people might think that they're backed up, things aren't draining properly. And that starts with that lymphatic system, which is located around the skull and in the neck. Here's a technique you can use to help milk or drain the lymph nodes around the neck. So I'm going to rotate my subject's head here, and the lymph nodes are located along this big muscle here called your sternocleidomastoid muscle, and behind the ear and behind the back of the skull here. And so if you were to take your hands and just gently massage along these areas, and you'll feel these little pea-sized nodules, which are your lymph nodes. Some may be tender, some may be hard, and you're just rubbing them to try to push basically the gunk out of those lymph nodes to help circulate that lymphatic fluid back throughout the body, allowing your sinuses to drain. Another contributing factor to sinus pressure within the head and neck can be from a misalignment in the neck or cervical spine. And so from a chiropractic standpoint, manipulating the cervical spine can allow for better movement and mobility and flow of the lymphatic system. Keep in mind, once again, any chiropractic manipulation needs to be done by a trained chiropractor who's done an exam on a patient to make sure there are no contraindications to a cervical manipulation.